Patients with hip pain are usually coming with kind of groin pain that they kind of experience, whether that's thinking that they have a pulled muscle, whether that's from an injury that's led to kind of chronic pain that's just involving just simple motions of walking that might be even keeping them up at night. You can come into the office and be evaluated with an x-ray. It's a simple conversation to customize an experience specifically for you, whether that's an injection, whether that's anti-inflammatories and low impact and monitoring that arthritis, or if you're a candidate for total hip replacement. I do all my surgery through anterior total hip replacement, where we work between muscle opposed to cutting through. That provides the patient less pain, quicker recovery. That patient is coming in the morning and having that surgery performed where they're up walking several hours after the surgery itself. They then go home that night, see them back in a couple of weeks after the surgery, where patients are getting back to those low impactful activities, whether that be walking, cycling, swimming, elliptical, playing pickleball, or getting back into kayaking. Whatever adventure that is for that patient, we're getting that patient also back to work a lot sooner, within weeks opposed to months. So if you're experiencing hip pain or whether that's knee pain, you can simply give us a call. We don't need the referral from the primary care office. You can give our team a call. My team can take care of getting an appointment where we can evaluate your symptoms and customize an experience for you.